Welcome to part 2 of the BBL talk. So now that we've discussed what it is and why it's so popular, let's do a little bit of a deeper dive into the BBL. What's an ideal result? Do BBL smell? Oh my goodness. Let's talk about it. So before I get into what an ideal result, I want to do kind of another PSA, or rather, I want to break down what butt shots are, because I didn't discuss them in the last part. So, butt shots are using materials that are not fillers, not fat, to inject directly into the buttock to obviously augment the buttock. Things that have been tried and should never be done are things like free silicone into the buttock tissue. A silicone implant that's well enveloped with the capsule is one thing, but actually injecting free silicone into the body anywhere is actually quite dangerous and should not be done. Silicone injections into the buttock can end up being hard because the body forms scar tissue around them. They can be very painful. They can actually put pressure on the sciatic nerve, which can cause disturbances in leg sensation, leg mobility. And if that weren't bad enough, they're very difficult to reverse. If you get a BBL with fat, you can simply lipo the fat that you inject. Very reversible. If you get butt shots with silicone or other kind of industrial products, you basically have to open it up and take it out. It can be very disfiguring to remove, and it's very hard to remove all of it. So don't do that. Don't do that. I know we've hopefully moved away from that. People aren't getting them done in the back of a salon anymore, I hope to God. But if you're ever told about butt shots and offer them, please stay away. The only things that are safe to inject are fat and fillers. We've used Sculptra, which is a collagen-like filler. We've used hyaluronic fillers, which don't last as long, but the idea is they are natural materials that you would find in the body otherwise, and so can be used with minimal danger and risks. And then if you don't have subcutaneous fat and you can't afford fillers, then maybe a silicone implant is good as well. But please, don't go to the salon, get your hair done, and then decide to go in the back room and get some butt shots. And the other thing is, insurance will not pay for excision or removal. I've had patients who've come to me who had butt shots long ago, 10, 15 years ago, and now they're very hard, very painful, difficult to sit, difficult to move. Some of these patients can't even work because they're having such constant chronic pain, and insurance says, no, you had this done as a cosmetic procedure. We will not pay to address the consequences of your cosmetic procedure. So please, be well informed. I always have to scare you first, I think. I don't know why, but I feel the need to make sure that people really understand the weight of what they're doing when they make the decisions to change your body. I love plastic surgery, have a knife, well cut, but at the end of the day, we gotta do it safely, right? And we gotta do it thinking about long-term results. Period. So what does an ideal BBL look like? Well, I think ideally it should look natural, in my opinion. There are a lot of people who like the more exaggerated look, and frankly, I don't really know why. So natural proportions have been studied and looked at to determine what is the ideal proportion. Regardless of people's gender, ethnicity, age, what are the ideal proportions for a woman's body? And what's been found is if you're looking at a woman straight on, the ideal ratio is 0.65, between 0.65 and probably 0.70 in terms of the waist to hip ratio. If you look at a profile of someone's body, of a woman's body, then that ratio becomes more squarely 0.70, with the ideal fullest point of the buttock being at the halfway point of the buttock. So keeping that in mind, a good result seems self-explanatory. Another thing about a good result is that it also addresses the thighs, right? When you have bigger hips, you tend to have bigger thighs with that. And so a BBL that only looks and addresses the buttock without really looking at proportions to the waist, to the lower extremities, really is an unnatural looking BBL. And one that we should probably move away from. But again, your body, your choice. And I think a lot of people still are holding on to as big as the butt, we used to say the higher the hair, the closer to heaven or something like that. And now it's like the bigger the booty, the closer to, I don't know, heaven maybe? I don't know. But I don't think that that's true. We've gotten away from hair being so high. Maybe we should get away from the butt being so big. Just my opinion. So BBLs personally are not my favorite procedure to do or to see done. For me, as a plastic surgeon who likes to work with their hands, there's not a lot of working with your hands and intricacies involved in fat grafting. It's lipo for a few hours and then injecting. So there's not really that much that's exciting for me as a plastic surgeon about the procedure. I think the other reason why I don't like it is that it seems like everyone is getting it with little variation in that. And the people who get it, a lot of the time you can tell that they had it because it looks so disproportionate to the rest of their bodies. I recently learned the term and I've used it a few times, maybe in this video and other videos, the ant body. And where is the lie? Like it does look like some people just have dump trucks on their behinds. To me, it's not really attractive, but again, beauty is in the eye of the beholder. And I think the other reason why I'm not really a fan of this procedure is that it is quite, or it can be, I should say, it can be quite dangerous, especially in the wrong hands and done on the wrong patient. Again, not every patient should be offered surgery. Some people are not optimized for surgery no matter what the surgery is. And so I think that's the other thing that we're missing in this piece, or tend to miss in this piece, is the kind of adherence to really, really strict safety standards. And if you can go to a hair salon and get butt shots and you're choosing to do that, then again, that's another reason to not like the BBL. It shouldn't come to that, right? So yeah, not my favorite, but again, I live with my small booty, and sometimes I hang my head in shame. Not really, but sometimes, it's a small booty. I can't do nothing with it. But it works. It works for me. So lastly, this question has come up, do BBLs smell? And there have been a lot of theories put out there. I'm gonna curse. Wash your ass. Just wash your ass. It's really that simple. So there's a theory about it's fat that's being excreted from the incisions. Not true. And I would say that, so let me actually break it down a little bit better instead of being rude. So after surgery, I think most people have a post-surgical smell, right? It's the smell of body fluid. It's the smell of blood, and that can leak from incisions. And so that's why I encourage my patients to shower the next day. There's no data to suggest that waiting longer minimizes infection or anything like that. So if you come to me as a patient, I will tell you and I will encourage you, please shower tonight, tomorrow. Don't be all rough. Don't scrub everything. Don't, get in there and go ham. But I do want you to just shower and, whatever has leaked in the first 24 hours can easily wash off. So that being said, I think there is a general post-surgical smell, and that smell can be addressed with a good shower and some soap and water. I'm not trying to be condescending. I'm just trying to be real. It's just real. There have been theories that you excrete fat after the BBL. Not true. So more than likely, if you're leaking what we call tumescent solution, which is the solution that we use to lipo. That solution is basically saline, some medication for pain, local medication for pain, and then another medication to help contract the blood vessels so that you don't have a lot of blood loss with the procedure. So if you're leaking, most likely that's what it is. And it may be blood tinged because you're alive and healthy, and that is part of normal surgery. So this idea that fat excretes doesn't really hold water. What happens to the fat that does die is that it usually gets reabsorbed by the body. Sometimes it can locculate and form these nice little pockets of fluid, but by and large, the fat gets reabsorbed by the body that doesn't survive. So there's no real fat excretion, and again, there is, I think, a general post-surgical smell after you have a procedure done. But the bottom line is, wash your ass. And I think that the larger the booty, it can be harder. It can just be harder. So get in there and really wash. Don't be afraid. You won't hurt anything. But at the end of the day, talk to your surgeon. I really want people to follow with their surgeon and follow their surgeon's instructions. These are what I tell my patients. I don't tell them to wash their ass. However, I do try to find a more respectful way to say it. But but you get the point. Hygiene is very important. And it's not only important just to live, it really does help with healing if you're keeping things clean, period. So let me know your thoughts below. As always, love you lots, and bye for now.